Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be starting with the new topic, that is forensic odontology, which is a very important aspect of forensic techniques. Okay, so in this session we will be covering part 1 of this topic. Okay, so let's start. Now, what is meant by forensic? By this time you should know. So the word forensic is derived from the Latin word forum, which means court of law, and odontology is the study of teeth. Okay, logy means study and odonto comes from the word teeth. So forensic odontology will thereby be defined by the Federation Dental International, FDI, as that branch of dentistry which, in the interest of justice, deals with the proper handling and examination of dental evidence and with the proper evaluation and presentation of dental findings. Okay, so this particular definition is quote unquote. Why? Because it is given by the Federation Dental International. So basically it is the study of teeth based on the interest of justice. You need to provide justice to the victim, and on the basis of that you need to do study of the proper dental evidence that you have come across from the crime scenario. Okay. Okay, so this chart actually shows the two major aspects of forensic odontology. So one will be crime investigation and the other will be personal identification, because teeth, depending on the our teeth structure, it's a very effective way of identifying a person, whether it's the victim or the criminal. Okay. So moving forward, as I always say, you need to know a bit about the history of every topic. So here also we need to know something about the history of forensic odontology. So the first forensic dentist was from the United States, US. He was known as Paul Revere, and he was known for the identification of fallen revolutionary soldiers. So I have just given an image of a soldier over here riding a horse. So in the year 1954, Texas burglary scene, means a burglary in Texas with bite mark in cheese, was found, and a case was filed, which was the state versus a person called Doll. Then in the year 1975, California sexual assault with bite marks on the victim's nose was there, and that case was the People versus Marks. Okay, moving forward with the history, I think this is even far before the previous the milestones that I mentioned in the previous slide. This was in 66 AD. Nero, the Roman emperor, so his mother Agrippina had her soldiers kill Lollia Paulina with instructions to bring back her head as proof that she was dead. So this was, a common ritual in the olden days by the kings and the queens. Okay, so she ordered her soldiers to kill this particular person, Lollia Paulina, who was female, and she also instructed her soldiers to take back or to come back with her head so that she gets the proof that okay, this person is dead. So Agrippina, the mother of this Roman emperor who actually ordered the soldiers to kill that person, he was unable to positively identify the head, examined the front tooth, and on finding the discolored front tooth, confirmed the identity of the victim. So it somehow happened that the mother, means Agrippina, she was unable to identify the head of this person, Lollia Paulina. Okay, but by identifying the front tooth, she confirmed that it was this person, Lollia Paulina. Why? Because she had this characteristic discolored front tooth. Okay, so these are, just what to say, small evidences of the origin of forensic odontology, as in the history. Okay, so a vital role the forensic dentist plays is in criminal investigation. While the frequency of such cases may not approach those of identification, their significance is certainly no less. Means there are not a huge number of cases where you can actually go for forensic odontology identification, but still their significance, means the even the small number of cases which can be solved with the help of forensic dentistry is very much important or significant. Okay, so forensic odontology crime investigation will include the investigation of bite marks, lip prints, and child abuse. Now see, child abuse is something which comes under a different topic, or a different totally a different subject criteria. Okay, so I will not be talking about child abuse in this session because it is entirely a different topic, a different concept. So because if I want to talk about child abuse, I have to talk about different other things also, which are not at all related with forensic techniques. And since it is a module, or it is a session or topic of forensic techniques, I will not include child abuse. I will only be talking about bite marks and lip prints. Okay, so before starting with bite marks, I would just like to give you a brief idea about the different functions of forensic odontology. Okay, so identification of unknown human remains through dental records will be the first important function. Okay, ID for identification. Secondly, assist at the scene of a mass disaster. Thirdly, age estimations of both living and deceased persons. Then analysis of bite marks found on victims of attack. Identification of bite marks in other substances like wood, duct tape, pencils, leathers, and foodstuffs. Analysis of weapon marks using the principles of bite mark analysis. Presentation of bite and weapon mark evidence in court. Building a picture of lifestyle and diet at an archaeological site. So these can be the different functions of forensic odontology. Okay, now before starting on with the main subjective part, that is bite mark analysis, I would just like to give you a brief idea about the arrangement of teeth in humans as well as in animals like dog, canines. Okay, so talking about humans, firstly we need to know the arrangement of child's teeth. Okay, so development of a child's teeth can help estimate the age of a young victim. If the victim is a young person, say 10 or 12 years old, girl or boy. So if we have an idea about the development of the child's teeth, it will be easier for us to estimate the approximate age of that young victim. So see, we have the upper teeth set and we have the lower teeth set. We all know that. So in the upper teeth set, we have the second molar, which appears at around 25 to 33 months of age. Then we have the first molar, which appears at around 13 to 19 months of age. Then we have the cuspid, which appears around 16 to 22 months of age. Then we have the lateral incisor on both sides. Obviously, I've in this diagram they are showing just the teeth of one side, but it's just two sets in pairs. Okay, so lateral incisor will appear at around 9 to 13 months. Then we have the central incisor, which will appear at around 8 to 12 months. And then coming to the lower teeth set, again we have the second molar, 23 to 31 months. Then we have the first molar, 14 to 18 months. Then we again have the cuspid, 17 to 23 months. Then we have the lateral incisor, 10 to 16 months. And finally the central incisor, 6 to 10 months. So see, the teeth are the same. Second molar, first molar, cuspid, lateral incisor, central incisor. The teeth are the same, but the age of appearance differs. Okay, in the upper teeth as well as in the lower teeth set. Okay. Okay, now moving to the dental chart for humans, means adults. Okay. Okay, so as far as the dental chart for humans is concerned, see, again we have upper teeth and lower teeth, but the age will be different. Okay, so we have the central incisor, which will appear at around 7 to 8 years of age. Then we have the lateral incisor, it will appear around 8 to 9 years of age. Then we have the canine, which is also known as the cuspid. It will appear around 11 to 12 years of age. Then we have the first premolar, which is also known as the first bicuspid. It will occur at around 10 to 11 years of age. Then we have the second premolar, which is also known as the second bicuspid. It will appear at around 10 to 12 years of age. Then we have the first molar, 6 to 7 years of age. Second molar will come at around 12 to 13 years of age. And the third molar, which is also known as the wisdom tooth, it will appear at around 17 to 21 years of age. Okay. Okay, now coming to the lower teeth set. Okay, so in the lower teeth set, firstly we will have the third molar, which is again known as the wisdom tooth. It will appear at around 17 to 21 years of age, same age limit. Second molar will be around 11 to 13 years. First molar will come at around 6 to 7 years, so more or less the same. Second premolar or the second bicuspid will appear at around 11 to 12 years. First premolar or the first bicuspid will occur at around 10 to 12 years. Canine or cuspid will occur at around 9 to 10 years. Lateral incisor will occur at around 7 to 8 years. And the central incisor will occur around 6 to 7 years. Okay. Okay, now as you can see in this image, there are some dark markings, isn't it? Over here you can see here, okay. And in this case also most of the tooth are being marked by dark markings. So these dark markings, they basically identify specific characteristics. What kind of specific characteristics? Like fillings, caps, chips, evidence of dental work. Dental work means some kind of extra dental apparatus or extra dental what to say uh, like additions, okay, that are there in many people, isn't it? Some people go for fillings, some people go for golden tooth, some people go for clippings, chips are there, caps are there, dental capping can happen, okay. So these can also serve as important aspects of forensic dental evidence, okay. Okay, now this chart I have given just to give you a brief idea, because we are talking about young children dental setup. We are talking about human dental chart. So we should also have a basic idea about the veterinary dental chart. Okay, means the animal bites. Okay, because animal bites can, in many cases, the criminals, they use their pet dogs or pet cats to kill a particular victim. Okay, so in that case, you need to have an idea about the animal bites also. So over here the dental chart that I've given is of a dog, okay. So we have the right upper jaw, we have the left upper jaw, then we have the right lower jaw and the left lower jaw, okay. So the characteristic tooth or teeth that they have are the canines, and that's why they're also known as canines, okay. So in the first ekdam in the front, they will be having incisors, okay, around 6 incisors will be there. Similarly in the left, in the lower jaw also it's the same scenario. Then they will have the canine, again the same scenario in the lower as well as the upper jaw, two canines on two sides, right and left. Then they will be having premolars, okay, four premolars on each side. See, again it's the same thing, both on the upper as well as on the lower jaw, both on the right and the left sides. Then they will be having two molars, again on each side, okay. Okay, now the molar thing will be different. On the upper jaw, they will be having only two molars each on the two sides, but on the lower jaw, they will be having three molars on the each side. Okay, three on the right, three on the left. Okay, so that is the only distinction or difference. Otherwise, everything else will be the same. Okay, at the beginning, 6 incisors, then two canines on each side, then four premolars on each side. But coming to the molars, in the upper jaw, there will be only two molars on each side. But on the lower jaw, there will be three molars on each side. Okay. Now coming to the main content of today's topic, that is bite marks. I think in this session, I will be only talking about bite marks. In the next upcoming session of forensic odontology, we will be talking about lip marks. Okay, or lip prints, sorry, not lip marks, lip prints. Okay, now what are bite marks? When you are biting someone with your teeth and you are leaving behind mark, just as tool marks. Okay, tool marks was marks produced by tool, bite marks will be marks produced by teeth, as simple as that. So now how do you define bite? Bite is, it means to tear or seize with the teeth. So this is a typical bite mark that I have given over here, the image of a typical bite mark. Now how will you define a bite mark? Bite, so you have defined is as it is to tear or seize with the teeth. Now, how will you define bite mark? It is a mark caused by teeth alone or in combination with other oral parts, or consists of teeth marks produced by the antagonist teeth, which can be as two opposing arch marks. Antagonist teeth means opposite to each other. Okay, so it can be only done with the teeth also, or it can be done with teeth along with help of other oral parts like your tongue, okay, your saliva. So biting is a primitive type of assault. Primitive means olden or primary or basic. It is often used as the weapon of last resort. Now this thing is very important, and it is mostly, I would like to mention over here, Biting is mostly used as last resort. Means what? Last resort means your last chance. Okay, last chance means mostly it's done by the victims to save himself or herself. It's an act of defense rather than an act of attacking. I would just like to mention this over here. Okay, so now bite injuries can be seen in forcible rape. Now see, rape means it's forcible only. Okay, there's nothing called forcible rape. Rape itself is forcible. So it can be seen in rape, it can be seen in young children, and it can also be seen in hand to hand mortal combat. Means when two people are quarreling with each other, they are getting in what to say, a fight with each other, but they are empty handed. They do not have any weapon with them. So it's a natural instinct of humans to attack with the teeth. Okay. Now, in the year 1974, there was a scientist called MacDonald. He defined bite mark as a mark caused by the teeth, either alone or in combination with other mouth parts. So, among other mouth parts, two important parts will be your saliva and your tongue. Okay. Okay. Now, bite marks may be caused by humans or animals. They may be on tissue, food items, on other objects. There are significant differences between a human bite and that of an animal. That's why I've already showed you and explained to you how the dental chart of humans and animals looks like. Because like animals, we do not have those larger canines. We have canines, but they're smaller. Okay, so we do not have those large canines. Incisors, we do not have so much six incisors on the frontal part. No. So obviously the bite mark will also be significantly different between that of a human bite mark and that of an animal bite mark. Okay. Okay, so I've just given you a chart, a nice chart or a table, which will help you understand the basic differences between human and animal bite. Okay, so see, firstly, we will be talking about the arch size and shape. So in humans, it will be broad, U-shaped, circular. In animals, it will be narrow, ant aspect, V-shaped or elongated because their teeth arrangement or tooth arrangement is also like that, V-shaped. Isn't it? Firstly, they are having the molars, then they are having the premolars, then they are having the canines, and then in the front, they are having the incisors. So the incisors are in the shape of an arc. Okay, so it will be a V-shaped thing. Okay, now secondly, coming to teeth. In teeth, humans will be having broad, narrow, and blunt teeth, while animals they will be having narrow central, broad lateral, long and sharp canines. Okay. Third will be the injury pattern. Injury pattern in case of humans it will be bruising and laceration. In case of animals it will be severe laceration. Laceration means when the skin comes out. That is laceration. So in case of animal bite, the laceration will be severe. There will be avulsion and there will be greater skin damage. So basically, animal bite will be much more harmful than a human bite. And nextly, last but not the least, sight. Sight of humans can be breast, abdomen, back, shoulder, and animals will be extremities or exposed skin because they are not, accessible to all the parts of the body because there is height difference. They are having like four limbs, we are having two limbs. So there's a like the animals will not be accessible to each and every body part of the humans. So they will attack the or they will target the extremities like the legs, okay, the head, the butt region, okay, or exposed parts, exposed skin. Okay. Okay, now coming to a very important topic, that is classification of bite marks. Okay, now there are different classifications of bite marks depending on different, depending on the suggestions or the views of different scientists. Okay, so we will be starting about all those classification systems. I think three classification systems are there. Okay, so number one is Cameron and Sims classification. So it's given by two scientists, one named Cameron and the other named Sims. So this classification system, it's again divided on two categories. One is depending on biting agent and the second is depending on material bitten. So depending on biting agent, may obviously humans will be there, animals will be there, and mechanical will be there. So humans may, it can be either children or adults, two varieties only. Animals may, it can be mammals, it can be reptiles, it can be fish. Thirdly, it is mechanical bite. If the biting agent is a mechanical biting agent, then it can be full denture or it can be belt marks. Okay, so that was the first category under Cameron and Sims classification, that is depending on the biting agent. Second category is depending on the material bitten, means what material the biting agent is actually biting on. So it can be skin, first and foremost skin. It can be skin can be the material bitten in case of humans or in case of animals. Isn't it? Only these two options are there. Second, it can be on perishable items. Okay, perishable items means those items which can be ripened, which can be getting rotten. Okay, so there comes food items like cheese, apple, etc. And third will be non-perishable items. So non-perishable items will obviously be the inanimate objects. Okay, inanimate objects like pipes, pens, pencils, which will never be which will never be ripened or rotten. Okay, so those will be the non-perishable items. So these three will come under the category of depending on the material bitten. So one will be skin, one will be perishable items, and the other will be non-perishable items. Okay, so these are the two categories based on the Cameron and Sims classification. Moving forward, we have the next type of classification, which was given by the scientist MacDonald, who also gave us the definition of bite mark. I mentioned it, I already talked about it in the one of the previous slides. You can just go and check. Okay, so MacDonald's classification, what is it? Okay, so this MacDonald's classification is based on etiology, equally applicable to marks on other materials. Okay, now what do you mean by etiology? Okay, so etiology is basically the cause. Okay, so what is the cause of the bite mark? Based on that, McDonald's has come up with his classification, which is equally applicable to marks on other materials. So firstly, we have tooth pressure marks. So it is the marks as a result of direct application of pressure by teeth. It can be by incisional or occlusal surfaces. Second is tongue pressure marks. So tooth pressure is caused when the material is taken into the mouth and pressed by the tongue against the teeth or palatal roof. The marks thus left on the skin are referred to as suckling, since there is a combination of suckling and tongue thrusting involved. These are mostly found in sexually oriented assaults. And then we have the tooth scrape marks, uh, which is teeth scraping, which comes across the surface of the skin. It is usually caused by anterior teeth and it is present as scratches or superficial abrasions. Okay, so according to McDonald's classification, we have three kinds of bite marks. One is tooth pressure mark, one is tongue pressure mark, and the other one is tooth scrape mark. Okay, I will just highlight it for you so that it becomes easier for you. So one is tooth pressure mark, then we have tongue pressure mark, and then we have tooth scrape mark, which is also known as teeth scraping. Okay, and then what we have is we have Webster's classification. Okay, so according to Webster's classification, it refers to the marks, bite marks left in foodstuff. So that's why I have given a nice diagram of Tom and Jerry cartoon showing a slice of cheese. Tom is actually fighting with Jerry for that slice of cheese. So it basically refers to those marks which will be left in foodstuffs. It's common in theft or robbery. So these can again be categorized into three types: type 1, type 2, and type 3. Type 1 will be food item fractures readily with limited depth of tooth penetration. Example, hard chocolate means those foods which will be hard, which require a nice bite. Then type 2 will be food item fractures with considerable penetration of teeth. Example, bite marks on apple and firm fruits. And then type 3 will be complete or near complete penetration of the food item with slide marks. Example, cheese. So one will be limited depth penetration. That will be examples like hard chocolate. Type 2 will be moderate or considerable penetration, which will include hard and firm fruits like apple, pear, etc. And type 3 will be complete penetration, which will include foods like cheese slice, which I have showed in the picture. Okay, so these are the three types of classification regarding classification of bite marks. Okay, so one is MacDonald's, one is Webster's, and the first was Camels and Sims. Okay, so I think in this session we will keep it up to this. In the next session we will be continuing with a part of bite marks because it's left over. Otherwise this session would have been longer. So I've just kept it short. So in the next session we will be talking some remaining leftover part of bite marks, and then we will be moving on to the lip prints part. Okay. So till then, thank you, goodbye. Please do revise, keep brushing up. Okay, otherwise you will get confused, and shortly we will be coming up with the next session. Please like, share and subscribe ITLS Academy. Thank you.